And we're back now with former FDA Commissioner Dr. Scott Gottlieb. Good to see you here, back for another week.
Thanks.
And you've been telling us sort of what to prepare for next, and I want to dive into some of that with you. You heard Dr. Fauci say they're coming, but they're not really here yet in terms of kits and availability to actually go and have it processed if you need a test. What's the timeline?
Well, I think we're going to see a dramatic increase in diagnostic capability this week. So I think by the end of the week, tests are going to be readily available. They approved tests on what we call high-throughput systems, meaning systems that can run literally tens of thousands of tests a day inside academic labs or the large clinical labs like LabCorp and Quest. Once those facilities have those systems online, they're going to be able to process an awful lot of tests, and they'll have them online at some point this week. So by Friday, I think testing is going to be pretty ubiquitous.
Now, hospitals are trying to plan for the future here. How are they positioned? Are there enough medical supplies?
Not if we have a Wuhan-style outbreak in a major city or multiple cities, which is my concern, that we can have outbreaks of that proportion in multiple U.S. cities. If you look at Wuhan,
Wuhan-style. You're saying the numbers that we are seeing and have seen in China.
Right, in a major U.S. city. Remember, Wuhan was the size of New York City. At the peak of that epidemic, they hospitalized about 20,000 people. 10,000 were in serious or critical condition, and 2,000 were intubated. To give you a basis of comparison, New York State, the entire state, has 50,000 hospital beds and about 3,000 critical care beds, and about 20,000 of those beds are in New York City. So if we have a Wuhan-style outbreak in New York City, that's going to overwhelm the system. So they need to be building surge capacity right now in anticipation of that possibility. Now, there's ways to avert it, but that's the risk that we face right now.
Tens of thousands.
We'll certainly hit tens of thousands of cases in the U.S. Hopefully, we won't hit hundreds of thousands of cases. But right now, if you look at some of the good research out of the Hutch by Trevor Bedford and others, they're saying that there's probably 10 to 40,000 cases right now distributed across the U.S. I think the risk that we have in the U.S. is we're a much more mobile population. China was able to confine their epidemic largely to Wuhan. The risk here is that we have multiple cities that are seeded right now, and so we'll have multiple Wuhans. That's the bad case scenario.
Multiple Wuhans is an incredible thing to say. The Pentagon came out and put travel restrictions on U.S. troops traveling domestically. They can do something like that. Right. Do you expect to see other government agencies, and should Americans be expected to essentially be on lockdown? Look,
there's no question that the steps we're taking right now is changing the course of this epidemic. We're already impacting this, but I think we need to do much more. And so steps like banning government employees from non-essential travel or state employees, that will have an additional impact. We need to be doing all of these things, leaning very hard into this. The best case scenario is we look back a month from now and we say to ourselves, wow, we overreacted. You want to be in a position, and Dr. Fauci made this point as well, you want to be in a position to say, we overreacted, it wasn't as bad as we thought it was going to be, but this is a once-in-a-generation pathogen. We have never seen anything like this before in modern times. This is going to be historic right now.
So should cities like Seattle and New Rochelle that are hotspots be on lockdown?
I don't think we can quarantine a U.S. city and lock it down and deny people their liberty in this country. I think what we can do is slow economic activity to a point where people have no place to go. If you close the theaters and you close the restaurants, you close large gatherings, you tell people not to have dinner parties, you tell businesses to have non-essential workers telework, people stay home. There's no place to go. I think that's the solution in the United States, not to put a city on lockdown. I don't think we're going to get there. We might. I hope not.
Is what New York State doing a model for the rest of the country?
I think Andrew Cuomo has been leading very far ahead. I think he's been very aggressive in doing a good job. I'm concerned that the city hasn't closed public schools. Private schools are closed, public schools are not.
Yeah.
And you do start to worry that people's ability to protect themselves is going to break along socioeconomic lines, where lower income Americans will not have the same opportunities that middle wage and higher wage earners will, because they can telework, they send their kids to private school, they're in suburban districts that close. That's got to be a concern.
And we will talk about that ahead with Larry Kudlow and others. But I want to take a quick break and come back on the health risks, more conversation with Dr. Scott Gottlieb, and some of your questions answered ahead. Stay with us.